The next will be Professor Lazennec with his presentation, How to Handle a Lumbar Disc Alignment Problem.
So, my topic is a very simple paper because I chose two cases with difficulties to understand the failure. Those two patients did not give us problem because we revised them. This is post-op X-ray. You see, we did anterior approach. We do currently this type of CT scan to see the vessels and to see if we have abnormalities, and we had no problem to revise. It is not the question for us in those two cases. The main problem was to analyze those two cases. Case one is a male, 41 years, and he has a poor result since the beginning. As in the cases, in some cases, we have a lot of difficulties to understand why they have pain. This patient has no radicular pain. He has lumbar pain, and he feels what he described as instability. This guy is very strict. He explained very well what is feeling. You have here the dynamic X-ray. You have standing X-ray. You see the neutral position, hyperextension, flexion with this kyphosis inside of the prosthesis, and here in sitting position. And he described he has more pain in sitting position, and especially he feels some pain when he turns the trunk. We spoke mainly about the sagittal plane, but this rotation of the trunk has not been discussed a lot today. So we have the EOS image of the patient. As you probably understood, we use standing and sitting X-ray. You have the standing X-ray, and you have the anterior opening of the prosthesis standing, closing the prosthesis anteriorly in sitting position. And something was very surprising for us. It is this problem of alignment of the pelvis. So you see in the sitting position, the pelvis is more or less horizontal, and in standing position, this patient has a pelvic obliquity, which means that probably this patient has some leg length discrepancy. So we analyzed with the EOS. We have all of the value. You have here the sacral slope sitting is 15 degrees. In standing position, it is 32 degrees. And the incidence angle is about, I don't remember exactly, the incidence angle is 45 degrees. So not a very abnormal patient, but mainly with this, probably this leg length discrepancy. So we were a little bit disturbed by this. We used wedges in the shoes, no results. And we did sacroiliac joint injection, facet joint injection to try to understand. And the facet joint injection was positive despite no abnormality on the CT scan, so they seem to be normal. And this X-ray was very surprising for us, you see, with apparently some discrepancy between the position of the superior and inferior end plate. We mainly look at the lateral X-ray, but AP X-ray is also something interesting. So this is center of rotation. You see flexion in standing position. You have here the location of the center of rotation. Flexion in sitting position, which is, you see the center of rotation is inside of the prosthesis, and the full range of motion is, the center of rotation is inside of the prosthesis. So probably some problem. What EOS provide us is a rotation of the patient. And this can be interesting. We are not accustomed to use those data, but you have a flying view of the patient. You are able to do those reconstruction, and you have the vector of the vertebra. And you see in standing position and in sitting position, this orientation of the vertebra is strange because it is not in the axis of the pelvis. And you see between standing and sitting positions, there was a huge rotation inside of the prosthesis. And probably it was our hypothesis, it was the explanation of this strange feeling of instability. So we revised this patient, and just after the surgery, he had significant relief of the pain. And you see here very well this orientation of the vertebra. You may be not convinced by this, and I present you another case. 50 years old. You see here this patient has this dynamic situation of the vertebra. This time you see there is no abnormality in the AP view. And the same thing, he has poor results with lumbar pain and this feeling of instability between standing and sitting. So at the beginning we thought this guy was crazy, and so the doctor thought he was crazy, the physiotherapist thought he was crazy, and we tried to do dynamic X-ray. You have here flexion extension, you have here bending, lateral inclination. We did not find a lot of things. So again, this is EOS standing and sitting X-ray. You see this time there is no leg length discrepancy. The pelvis is perfectly horizontal. And when you look at this, you see that apparently there is no significant abnormality. We see that in sitting position, the sacral slope is 7 degrees. The incidence angle is 51. Standing, of course, the incidence angle is the same. And you see that the sacral slope is 34. So nothing very, very strange. But despite this patient described very precisely a feeling of instability. So here is location of the center of rotation. This time it's not really, there is not really abnormality. It is the center of rotation is, we can discuss this of course, but is below this mechanical prosthesis. And what is strange is this analysis with EOS. You see here you have the vector of L5 regarding the axis through the two femoral heads. You have this direction standing and this direction sitting. And when you look at the rotation of the vertebra, you have here about 7 degrees rotation to the left in standing position, and here 5 degrees rotation to the right. So it means you have about 10 or 12 degrees rotation inside of the prosthesis. So we did the revision of this patient, and he had very good relief. And you have here, as a proof, the analysis of the patient after the fusion. So you have the standing and sitting X-ray, and perhaps you are interested in looking at the positioning of the patient after this revision. Because we say, okay, we do the revision, but what is the further adaptation of the patient after this revision? And you see it is interesting because doing only this fusion one level, there is a complete modification of the global balance of the spine over this level. You see, where I admit you are slightly tilted on the left, but you see you don't have any more this variation of rotation. So to conclude, perhaps in some cases when we cannot analyze, when we don't have the explanation of a failure of the prosthesis, we have seen a lot of cases of failure, but sometimes we are not able to understand what is occurring exactly. Perhaps we have to look at other things, and to look, of course, at lower leg length discrepancy. We did not speak about this, but the subpelvic area is something interesting. We discussed a little bit at the level of at the cervical level, the center of rotation. You have seen that we are able also to analyze the center of rotation at the lumbar level. But perhaps analyzing the transversal plane can be interesting. Now there are few papers with a vector of the vertebra for scoliosis, and probably, perhaps, for the analysis of failed prosthesis, it can bring us very interesting information. Thank you.